So, what exactly is the NIH Public Access Policy?
The NIH Public Access Policy ensures that the public has access to published NIH-funded research. So researchers are required to submit their final peer-reviewed journal articles, those which have been funded by the NIH, into a digital archives called PubMed Central. These have to be submitted to PubMed Central upon acceptance for publication in a journal, although the author does have 12 months in which to actually have full-text access to put up in PubMed Central. The policy applies to all accepted publications in a journal on or after April 7, 2008.
But I thought the publisher owned the copyright for any articles I publish with them. Am I actually allowed to put the full text of my articles up on PubMed Central?
Well, before you sign a publication or a copyright transfer agreement, you do need to make sure that the publisher will allow you to retain enough of your copyright to submit your paper to PubMed Central, because the full text will be made available through PubMed Central to the public. So most publishers today, fortunately, do allow you to retain enough copyright to do so, but you really need to be sure that you notify the publisher that the paper is the result of NIH-funded research.
Okay, let's say I have enough copyright to do this. How do I actually submit an article to PubMed Central? Can I do it myself, or does the publisher do this?
Well, the easiest way is to submit your article to a journal or a publisher that automatically transfers the final manuscript into PubMed Central. There is a select list of journals that do this for you. Some publishers, while not participating directly in PubMed Central themselves, will send copies of your manuscripts to PubMed Central on your behalf. But you have to be sure to let them know that this is an NIH-funded research paper. And you will receive an email from NIH to finally approve the actual PDF of your article. You can also submit it yourself into PubMed Central, or you can have a third party do it on your behalf. And librarians at the Cushing Whitney Medical Library are always happy to assist you with this. It's very easy, and it takes very little time.
Now, I know that I am required to have the PMC ID numbers for many of the references I listed in my CV. What is a PMC ID number? I know what a PM ID number is. Is it different from a PM ID number?
It is different. You may have heard of PMC IDs because you do need them now attached to references for articles that you've authored when you're submitting progress reports, final reports, grant applications, and contract proposals to the NIH. There is a difference. PubMed is a database of indexed abstracts for articles. PubMed Central, on the other hand, is a database of indexed full-text materials. So the PM ID, which is the PubMed ID, is the unique number for all of the abstracts in PubMed. However, the PMC ID is the unique number for all of the full-text materials in PubMed Central, and that's the number you need. In fact, the PM ID has nothing to do with the NIH Public Access Policy.
Now, I understand that I can no longer use eSnap in my ERA Commons account to keep track of my own authored publications. Apparently, I need to use something called My Bibliography. What exactly is that? What does it do? Can you tell me more about that?
That's correct. As of July 23, 2010, PIs and PDs are now required to use My Bibliography, which is a tool in MyNCBI, to develop their publication lists. Essentially, you go into My Bibliography and you can search through PubMed very easily to pull in your authored articles into a nice CV format. You can also manually put in references for book chapters that you've authored, patents that you hold, publications or presentations you've given at conferences. This actually is replacing the publication list that you used to manually put in through eSnap in ERA Commons. You can no longer do that. You have to use My Bibliography.